not all friends and family are going to be excited or supportive of other people having plastic surgery. And so let's talk about the psychology behind that and how patients deal with their friends and family when they have something that really bothers them that they want to have improved, even though someone else might not think that it's is important. How do you help encourage and support your patients that are dealing with this?
It's a tough question because we deal with all sorts of variations on the theme. As you know, sometimes families can be very intermeshed and sometimes even controlling. You know, children can control parents, parents can control children. You know, to the point where, you know, even they're threatening or saying, you know, I'm going to withhold my love, or, you know, or something very drastic, you know, or I'm going to be mean with you for the rest of the days on this planet, and if you do this. And you know, why those reasons are, I'm not sure. Maybe just, you know, exerting control. I think that the people that decide to take the step to improvement, whether it's, say, to get an additional degree or whether it's to improve their appearance, are, you know, in a group of people that are more adventurous, they're more brave, they're more, you know, they're out looking and
respecting themselves.
Yeah.
Maybe following through with what's important to them, not listening to what other people think.
Absolutely. And so I think the people that on the other side that resist even a family member having surgery are the people that, again, probably may never have that for themselves, and maybe they're afraid of change. Maybe they're afraid of if mom or my daughter feels, or my wife feels better about herself and more confident because she's had cosmetic surgery, then, you know, will she leave me? You know, will she, you know, will the dynamics of our relationship change? You know, will they shift? You know, will they be now strong and not held captive by this particular problem? And I mean, I had one husband, really, it's like it dawned on him when I was pointing out some of the improvements in his wife about, 10 days after the surgery, and we were talking about some of the improvements and looking at the before picture, and he was looking back and forth, and he said something to me that was very enlightening. He said, wow, I'm going to have to be a lot nicer to you. And I think, you know, we all get comfortable with our spouse, and we all tend to take those people, unfortunately, sometimes way too much for granted. Right. And which we shouldn't. I mean, we should be nice to one another all the time. Right. And he should have, you know, he should be, you know, why should he have to step up his game because she looks better? Well, now, you know, he feels maybe a bit threatened, or, you know, is this going to affect my relationship with her? Many times that fear is not really a reality. You know, many times that's about you know, that person wanting to be, for example, a better wife, and feel, you know, have those thoughts of that appearance of looking aged, you know, not in the forefront of her mind. And so she can be a better person, better wife, better companion. I mean, that's really what it's all about. It's not necessarily, you know, only in rare circumstances is it about, you know, the first move before moving out, or, you know, changing lives or anything like that. It's not that dramatic, and it's not that scary. It's really all about feeling better internally.